Information Station 1370 WOCA. Ocala.
All right, 5 minutes after 11 o'clock. Thank you for tuning in. Nice looking Thursday, and we're going to learn about our bodies and ladies, especially your bodies. And I'm glad Robin's in the room. I'm just glad Robin's in the room. Yeah, this is the segment of the morning that might be the most informative segment of the morning, and clearly, as many of you out there will be paying attention to this because, well, we're going to talk about something that probably is pretty embarrassing, and there's a fix for some of these things. Dr. Porty Riley is in the studio. Good morning, Doctor.
Good morning.
Nice to see you. And Christy Paquette, am I saying your name right, Christy?
You are, yes.
Let me see if I have your information right here. And Dr. Riley, you are obviously an Ocala-based physician. You specialize in minimally invasive techniques using the Da Vinci robotic surgical system, right?
Correct.
That sounds scary. It's a robot, huh? And you'll help me out with that. And then, Christy, you are a doctor of physical therapy, and you're with Strive Physical Therapy?
Yes, I am.
Okay, and there's something in your notes that say pelvic floor physical therapy. So we'll find out what that is. Did I say that right?
You did.
Sounds like push-ups, pelvic floor. Sounds like push-ups. And of course, Leah and Susanna here again. Thank you, ladies, all for coming in here today.
Thank you for having us.
You're really outnumbered today.
I know I'm outnumbered. I got so many microphone things over here to make sure I'm getting everybody on the air. So, Doctor, let's start out with what you do. What does the is it a robot? What is it?
That's exactly what it is. So it's a surgical console that is separated from the patient, and it allows us to use very precise hand movements in order to remove any kind of human error during surgery. So the robot stands next to the patient, and I control the robot from a console about 8 feet away from the patient. But it allows us to see things we can't see with the human eyes, and also make very fine movements that we can't make with the human hand.
Wow. And where are you? I mean, what part of the patient is being worked on?
Well, we are primarily focusing on women's surgery. So we're focusing on the uterus, the ovaries, the fallopian tubes, or any sort of masses in the pelvis.
And what are you correcting? What's wrong with those patients?
So we use the robot for many purposes. We use it to correct patients that have fibroids or smooth muscle growths in the uterus. We also use it to correct uterine prolapse. We also remove ovarian masses or masses in the fallopian tubes.
Wow.
So many different applications for the robot.
Is that are they precancerous things that you remove?
We can remove precancerous lesions, benign tumors, as well as malignancies.
Wow. And some of this causes incontinence. Is that right?
There are procedures that you can correct for stress urinary incontinence using the robot, certainly, but it's primarily used for prolapse surgery today.
And help me understand what that means. What does that mean?
So prolapse means when one of the organs that sit on that pelvic floor diaphragm come down and live in the vagina when they shouldn't. For example, the bladder, the rectum can often descend into the vagina or even come out of the body.
Oh my goodness.
And that can be very uncomfortable for the patient.
I guess so.
So we want to restore that normal anatomy that has become stretched out over time.
So how does that happen? Is it something that every woman goes through as they get older, or?
Not every woman, but a good number of women do suffer from prolapse, and that's primarily because of childbearing.
I was going to ask that. Yeah.
Women that have had multiple vaginal births are at highest risk, and then also women that have occupations that involve heavy lifting, or women that have had chronic problems with constipation.
Does this cut down on the number of hysterectomies with this robotic technology?
No, the robot actually allows us to perform hysterectomy, but it also allows us to correct prolapse that happens after hysterectomy.
Oh, okay.
Oh, so a lot of things that you couldn't do before the robot, you can now do. Is that true, or is it more true to say you can do it more precisely?
We can do it more efficiently.
Okay.
So before, all of these procedures were done with a large incision on the abdomen. Now we can make very small incisions on the abdomen, and patients can heal very quickly and resume all of their daily activities quickly.
That is fascinating. So was it scary for you as a doctor to shift from being right there to being 8 feet away?
Not at all. Not at all, because I'm in complete control. So it doesn't matter if I'm a foot away or 8 feet away, I am in complete control of that robot. So nothing can happen without me controlling it.
Christy, Dr. Riley mentioned the pelvic floor. What is that? What is the pelvic floor?
Well, as Dr. Riley said, it's the diaphragm. It's the
same thing we breathe with? Am I the same diaphragm? No.
It is a type of diaphragm, but
Okay.
it's made of muscles and connective tissue. And it's the support system for the bottom of the pelvis.
See, I don't even know a man's physiology. I mean, do all women know this stuff?
No.
No. Okay. So I'm not. Could I ask you just to pull that microphone, just kind of aim it at you, then I'll be able to hear you a little bit better. Yeah. Okay. So when we talk about the therapy, so are you part two to what the doctor does? The doctor does the work, and then they come to you for the healing, or?
Well, we're kind of two sides of the same coin. Conservative treatment might be a preferable option before someone decides to try surgery.
Oh, so you might be step one.
We may be step one.
Okay.
Exactly.
All right. So some of the circumstances that the patients would be going through that the doctor just explained could perhaps be dealt with in a different way.
Exactly.
Without surgery.
Exactly. As women age, as we go through pregnancy and childbirth, if we have hormonal changes, our muscles and our soft tissue weaken, or they can be damaged through the process of childbirth. And so, physical therapy, we deal with muscles and nerves. And so coming to a pelvic floor physical therapist is basically looking at those muscles that are part of the pelvic floor, that they're internal, you can't really see them, but we can work on strengthening them.
You help strengthen them.
Yes, we do.
So there's an exercise that we
do exercise.
Ladies can do. How do you do the exercise? I mean,
No, men have the same muscle structure that women.
Is there a way to say to me, to everybody listening, how you do those exercises? I mean, what do you move?
Right. Well, that is the tricky. That's the tricky part.
This is tricky.
It's what. Basically, we're working with the Kegel exercises that a lot of people are familiar with the term, but how do you do one? How do you teach someone to do one? I can teach you how to bend your elbow and do a bicep curl, but how do I teach you how to do it?
Right, that's where I want to know.
Well, that's where my specialty comes in, is, I work with women to try to help them isolate those muscles and be able to effectively strengthen them.
Is it? Do they feel something they've never felt before? I mean, it's like,
some women do.
I have a. Whoa!
We could do it right now, and
So-
you wouldn't even know.
I'm so glad you're in the room
right now.
Ay,
You wouldn't
ay,
even
ay.
know we're doing it.
Suzanne, you bring me some great topics. I'll tell you what. All right. So,
Like I said, you're outnumbered today.
all right, but I wanted to make sure that the listeners know this is super serious, and if you're out there and this is applying to you,
It's very common. I think that's what it is.
so what?
It's
I mean,
common.
is it possible that we've had some lady listeners who say, "This is me. Please stop joking around. I want to know more about this." And so I don't want to go to the funny because that's typical of me. But I mean, there's got to be somebody out there who says, "Okay, I'm listening now. You've got me. That sounds like me." Is it possible that she knows something's wrong but doesn't know that it's this?
Absolutely. I've worked with women who have been to one doctor after another, and they've gotten prescriptions, or they've gotten pain pills, or they've gotten treatments that just don't work, or the doctor looks at them and says, "No, it's just in your head." And so they come to
So some
me.
doctors are naive to this or something, huh? Or just
Yeah.
not educated?
Yeah, yes, very much so. And then they come to me and I say, "Oh, I understand. Here's what's going on," and they're just so thankful and relieved that somebody actually understands what they're talking about.
Do you want to talk about symptoms so that somebody listening can maybe identify that maybe they're a candidate?
Common symptoms are often people will feel a sensation of heaviness in their vagina. Sometimes they'll have some groin tugging or pulling sensation. Sometimes they'll say it's very difficult to complete a bowel movement, or they'll say that they have frequent urination or they have trouble emptying their bladder. So those are often very common things that people will present to the office with. And sometimes they'll just say, I was taking a shower the other day and I felt something hanging out of my body.
Yeah.
So, and that's probably the most common thing people say,
Oh my gosh.
I'm sensing something there that's never been there before.
Yeah, right.
So it's better to go to the physician first and not try to self-treat it by going to the drugstore.
Absolutely.
And will this be one of the things that will be addressed, Suzanne, at the Women's Wellness Day?
Yeah.
On the 16th?
Yes, we have our second annual Women's Wellness Day on Saturday the 16th at CF. And we're going to have a health fair and expo in the morning. And there'll be a lot of representatives there, certainly from our women's services group, but also from cardiovascular and orthopedics and neurosurgery, bariatrics. All of our service lines will be represented there, and you'll be able to ask a lot of questions and hopefully get some answers. But and then we're having a guest speaker after that. But yes, we will be able to. If people want to stop by and get some more information on this, we'll certainly have it.
And that's at the college across the street.
It is.
Right?
It is. Yes, right in the main entrance there, and the lobby is where we'll have our health fair, and then move into the theater for lunch and a speaker after that.
And that's on the 16th.
That's on Saturday the 16th.
Saturday,
Yes.
what is
A week from this Saturday.
A week from Saturday.
Okay.
Yes.
And okay, so if you're listening right now and you're wondering if this is you, or maybe this is you, I mean, it's gotta. Is there a guys are different from women, so maybe I'm wrong about this, but it would be embarrassing if I had this. How would you even approach it? I mean, you'd have to walk in and say, "I got a problem. Can I talk to somebody in private?" Right? Is that what happens?
Well, that's the thing with this condition is sometimes it's so embarrassing that people just stay in their homes. They stop going out and socializing. They stop going out and doing what they want to do in their community. And so, if you have this problem, by all means, speak up to your doctor. Speak up to.
So once it's corrected, I mean, it must improve their lives unbelievably.
It can, yes.
I mean, they become more social again. They've probably got more things they're doing.
Absolutely.
It's life-changing. Nowadays, women are living much longer, and more importantly, women are staying active much longer. So women are playing sports in their 70s and 80s and even their 90s. And so when we correct these conditions, these women are able to play tennis 3 times a week, and they're able to walk every day. And so the rest of their health benefits as well, because they can maintain their physical activity.
Is this age-related? Because you had mentioned about multiple births, and maybe someone in their 20s might have 6 children by the time they're 30.
Absolutely. So at some level, it's age-related because that connective tissue weakens over time. But I've taken care of many patients in their 30s and 40s with prolapse as well.
Mm-hmm. Oh, really? And when... If Christie's therapy, if the pelvic floor therapy doesn't work and then they have surgery, do they then part 3 go back to Christie? Is there more therapy after the surgery, or that's not necessary?
I think it's really patient dependent.
It depends.
Sometimes the ligaments have just stretched out too much. The physical therapy before surgery is not going to help.
Right.
And so we go straight to the operating room.
Suzanne,
and other cases it's different, and Suzanne can address that.
I just wanted to ask if you were taking phone calls. So did you want to take phone calls from listeners?
If somebody calls in,
okay,
sure.
Okay.
Yeah.
So I wanted to make sure I invite people because it's possible you've got something, you've got a question, and Robin and I aren't thinking of it. So if you have a question and you'd like to call in, you are invited to. The number is 622-9622. That's the WOCA Climate Control Source Hotline. And see, I knew it. I knew as soon as I mentioned it, we'd get a call. You'll need the headphones in order to be able to hear the listener. So if you just put the headphones on, you'll be able to hear the listener.
All right.
Let me connect whoever it is. Good morning. Good morning. You're on the air. Thank you for calling.
Morning. How are you this morning?
Good.
I just recently met a friend that is having this issue, and her doctor said to wait a year for surgery. Is there some place I could send her to talk to somebody about this?
I would suggest I can give you our consultant nurse number that you can call.
Okay.
Yes, and that's 800-530-1188, and just explain what the conditions are, and then what'll happen is they will refer you to physicians like Dr. Riley who will be able to help you.
Okay, what was the last four numbers again?
1188.
Thank you very much, ma'am.
Sure.
Wow. So she was told to wait a year. Does that sound like bad advice to you guys? To you ladies?
I think that, it's hard to say why she was told that. Certainly, I think that if she's having the problem now, there are steps that she can take to begin correcting it.
Does anything complicate it, like weight? Like if you're overweight, maybe, I don't know the person, I'm not trying to imply anything, but could somebody maybe need to lose weight before they get the surgery, or?
Some of these forces are caused by gravity. So certainly in patients that are overweight, you're having more pressure on that pelvic diaphragm. So often losing weight will help tremendously in reducing the impact of the force that's put on those pelvic floor muscles.
And the body never corrects it itself, right? It always, I guess it does with the exercise, huh?
Right. Sometimes immediately after childbirth or after pregnancy or weight loss, women can rebuild their strength and these incontinent issues can be resolved.
Does diet help at all? I mean, the right nutrition and that kind of thing?
Well, anytime you looking at your overall system, you need to have good nutrition. You need to have good overall health. It can certainly be complicated by diseases like diabetes and smoking and those chronic issues that impact your overall health.
Can liposuction be a factor as to being detrimental to the workings of the body for the female if you have liposuction?
Not necessarily, but liposuction itself carries quite a significant number of inherent surgical risk.
Oh.
And so losing weight is certainly important, but I think that losing weight naturally is certainly the safest route to lose weight.
Yeah.
So, Christy, your patients are different ages, huh? They're not...
They are very different ages.
And from different cultural backgrounds, does that ever present a problem? I mean, we put so many stigmas on things that are sexual in nature. Does that ever present a problem?
Culturally, I haven't had an issue to date. I've had some communication barriers, some language barriers, some patients that have required translators to come in and work with us. But
oh, wow.
But everybody that I've worked with has been, very open and very willing to work and do what needs to be done to improve the condition. And we're dealing with not only the incontinence issues, but some chronic pain issues that can impact their relationship.
And when you do the physical therapy, do people have to go to your office to do this, or can you give them exercises and things to do at home?
Well, what we do initially is, I meet with the patient and we go over the procedures and we make sure that they're doing the exercises properly. That's the number one step is helping.
Can you see it? I mean, it's internal, right?
It is internal, and it's more by feel than by sight.
Oh, really? So you can feel the muscle tightening?
Absolutely.
How big is the muscle? Is the muscle tiny? I mean...
Oh, it's several muscles that kind of overlap and form a sling is what it is. It's a sling at the bottom of your pelvis.
Huh.
Several different thin muscles.
And men have that too, huh?
Men have the same muscle structure.
What does it do for us?
Same same function. Same function.
Just holds everything in?
You have the organs there. It helps suspend the organs. It's involved in their sexual response. It's involved in allowing defecation and urination.
And doctor, how do you help the patient get over the embarrassment, because certainly the patient has to be able to convey this to their spouse or a significant other? How do you help them communicate?
I'm a big believer in taking a lot of time on that first visit with the patient. So when my patients come in and we start discussing their issues, I try to make them feel at ease and let them know that the role of a gynecologist is to be able to share those things that you can't share with anyone else. So I really encourage them to be very open with me and tell them that I'm not going to judge them and I'm there to help them. And often they'll tell me everything, and I will tell them that it's okay to have those symptoms and it's okay to have the problems that they have. and that it's not anything abnormal or puts them, off to the side as taboo or anything else. And then I teach them and educate them on how to broach the subject with their husband and explain to them what they can do to improve their relationship and intimacy with their husband as well.
Wow. Let me just reintroduce you. Dr. Porty Riley is who you were just listening to right there, and Christy Paquette is in the studio as well. And we're talking about some new technologies and techniques for the treatment of, now, how do you pronounce the word? Urogyne? Urogyne, hard G. Urogyne conditions, and you've explained them before. Now, do you have the husband in the room, or I mean?
It depends.
Yeah,
sometimes for the first visit, patients prefer to be in the room alone with me. And that allows them to be very open about their problem and very open about how that problem impacts them emotionally, physically, mentally. And I think once we've done that and they sort of accept that the problem isn't a bad thing and it's something that we can treat, they'll say, okay, I'm okay with my husband or my significant other coming in here and us talking about it together.
And this is all done at Ocala Regional?
Yes, we at Ocala Regional as well as West Marion, both hospitals have services, and the robot that we were discussing is at Ocala Regional.
And Suzanne, Ocala Regional has had a lot of construction going on. How is it progressing?
Oh, well, we just opened our front doors, reopened them again on Monday, and so the parking garage is open, the front door is open, much easier access to everything. So
wonderful.
Yeah, it looks nice. Looks
excellent.
Very nice. Yeah.
What kind of robot is this? Is it something where you put your hands in something and then you guide it that way, or is it just like a computer with little zappers on the end? Or
okay, that's a very good question. So at the patient's bedside are 5 millimeter to 8 millimeter little incisions, and the instruments are inserted into the patient's abdomen at the bedside by me at the beginning of the case.
Oh, okay.
And then I walk over to a console which has 2 arms on it, and my fingers go into 2 little slots where my fingers rest, right and left hand, and my arms and wrist move exactly the way they would in an open surgery.
Wow.
So my motions of my wrist, the movements of my fingers, everything is exactly as if I am handling the tissue with my own fingers. So my motion doesn't change, but my motion is affecting those arms and those instruments that are in the patient that I put in at the beginning of the case.
Wow.
I would love to see that.
So it's almost like your fingers are inside.
Exactly.
Doing something you couldn't do unless you literally cut the person open.
Exactly.
So and
I am actually doing the cutting. So it allows me basically...
Like a Fantastic Voyage movie or something. Yeah. Anybody remember that movie? Wow. Are gynecologists I'm guessing women love having a woman as a gynecologist. I'm not a woman, but I would. It makes sense. Right? I don't know.
Well, I think that the issue is more being able to relate. And I always tell my patients that, unless you've had a period or you've had a baby, you just can't tell somebody what it's like until you've had miserable cramps and until you've had that feeling of prolapse and until you've birthed a child. You can't really feel what it's like to experience all of those things. Certainly, there are very good male physicians out there, absolutely.
No, yeah,
However, I think the preference for a female is based on the fact that, we're going through this thing together. Yeah.
So are there patients who have babies after the surgery you do, or is that?
There are certain prolapse techniques that we use in our younger patients that allow them to still have children in the future. Yes,
wow, and had they not had it, would they not have been able to?
No, but sometimes the process of delivery is more difficult, and sometimes patients can go into preterm labor as well.
And Christy, when you're doing the therapy for the patients, do sometimes the patients think the therapy is taking too long and they might feel really, really good, but you have to stress there's a time factor in doing certain things?
Yes, absolutely. Every patient's a little different, and people pick up on things more quickly. In some of the chronic pain patients that I've worked with, it's been frustrating because they'll have some success with working with me, and then they might have a couple of weeks or days of coming back and having that pain recur and frustration. But, we keep working through it. And
Wow. You are amazing, ladies.
We have a $20 gift certificate for Lori's gift shop.
Right, and now that the front entrance is open, it's much easier to get to Lori's gift shop now, so sure.
So we need somebody to call in and say you would like it. We won't bother you with a trivia question, but if you're the first one to get through, then you can have it. It's the number is 622-WOCA, 622-9622. Did the Affordable Health Care Act change anything about what you're doing? No?
Not up front.
Nothing that you know of? Okay, that's good. I mean, for the better or for the worse. I didn't know if it was going to apply. Good morning. You've got the $20 gift card. Who's this?
Michaela.
Michaela. Oh, you got a deep voice, Michaela. What? Is it going to be here, Susan?
It'll be here this afternoon.
It'll be here, Michaela.
For you to pick up later this afternoon.
Thank you very much.
Oh, you're welcome, Michaela.
Oh, yeah. You know where we are, right? Oh, yeah. Did you hear that echo and everything? Oh, yeah.
Yeah. She's sweet.
That must have been Mr. Michaela.
Doctor, when you were first introduced to this robotic technique, were you kind of nervous about it?
No, I was more excited more than anything else. I was really excited about the opportunity to allow patients to have surgeries that let them get back to life a lot sooner. The most frustrating thing about surgery sometimes and frightening thing for patients is, oh, doc, 4 to 6 weeks, I'm not going to be able to do this and that and work and exercise. And now I tell them in a week,
Wow.
and people are thrilled. And it's very satisfying for me to allow patients to get back to their lives more quickly.
Wow, yes.
I should add that Dr. Riley is one of several physicians at Ocala Regional that use the robot.
Oh, okay.
One of a few OBGYNs that use it, but also it's used for urology cases, bariatrics, general surgery, cardiothoracic. So it's got a lot of purposes. Oh, yes.
Really?
It just happens that for GYN condition, it's become quite popular and effective.
And it can it be used on like the nervous system, where there are?
There's not approved use for it yet.
Nothing like that.
Not
huh?
yet. No.
How about the unborn baby? Sometimes there's something physical that the unborn baby isn't developing. Can you go in there with that robot and try to fix it before the baby's born?
There is some laparoscopic fetal surgery going on these days. It's still experimental with the robot itself.
Oh, okay.
Wow.
This is fascinating stuff.
It's amazing how things change, and who knows what we'll be talking about in 10 years or 2 years, right? Well, thank you, ladies, all four of you, for coming in and sharing this with us. Ocala Regional and West Marion are the two hospitals we want to make sure we mention. Dr. Porty Riley, thank you so much.
Thank you.
Hope I wasn't too silly with you. And Christy Paquette, thank you.
Thank you.
And Suzanne and Leah, thank you, ladies.
Thank you for having us.
Welcome.
Do you want to give out a phone number, website, or anything?
The number just always have on hand is 800-530-1188. It can help answer a lot of your questions if you get through to the nurses. Also refer a physician, and also you can register for any of our classes, and also Women's Wellness Day coming up.
Yes. We'll continue to mention that. That's on the
Great.
16th, right?
Yeah.
What time is that?
It starts at 9 in the morning.
All right, okay. We'll continue. Make sure we continue to mention that one. Thank you, ladies.
Thank you.
All right, we'll take a little break, and we will be right back.
Habitat for Humanity of Marion County is a ministry dedicated to improving lives by providing affordable and decent housing. Help them help others by visiting the Habitat for Humanity Ocala home store on Northwest 27th Avenue. To schedule a donation, give them a call, and they'll come and pick it up. For more information, visit habitatocala.org. Habitat for Humanity of Marion County, building homes, building hope, building community.
Hurricane season is upon us. WOCA and Sunbelt Rentals wants you to be prepared. Sunbelt Rentals has the equipment to help, like air nailers, aerial lifts, chainsaws, chippers, and stump grinders. They have light towers, skid steer loaders, and generators, just to name a few. Sometimes you might need a little help cleaning up afterwards. Sunbelt has the equipment you need, like dehumidifiers, pumps, sewer snakes, wet dry vacs, floor dryers, carpet equipment, and more. And right now is the time to get it done, with 2 special offers just for WOCA listeners. If you rent Friday after 3 p.m. and return it Monday before 9 a.m., you will only be charged for 1 day. Plus, just by mentioning WOCA, you get 25% off your rental. You heard right, not 5 or 10, but 25%.